Good afternoon. I'm Dr. Lisa Pyer Berlin, or Dr. Lisa, as people call me. I'm the president and CEO of Parents Anonymous, Inc., one of the oldest family strengthening organizations in America. We run an evidence-based weekly support group for parents and a complementary group for their children and youth to build on their strengths, increase their resiliency, and address any underlying emotional issues they have. According to the federal government, Parents Anonymous is the only program that's culturally responsive, works with families of any age to improve parenting, successfully address mental health, substance abuse, and ensure child safety. And I'm very excited at the podcast today that we're launching, because May is Mental Health Acceptance Month, that we are launching our podcast called Breaking the Stigma. And I have as our guest today, Dr. Rehana Peiris, who is a clinical psychologist and the Vice President of Clinical Services. So we're just going to have a chat today about the helpline. Welcome.
Thank you so much for having me.
You're welcome. So why don't you, when people are thinking about, should I reach out? Should I call? Is there anything people should be considering before they pick up, call, chat, or text the helpline?
The helpline is extremely effective. We have people calling. You can call anytime, Monday through Sunday, 8 a.m. to 8 p.m. And what's so amazing is how diverse it is. There'll be a caller as young as 9 years old reaching out on the chat saying, I wet the bed and I'm scared to approach my parents. What do I do? And we have compassionate counselors that talk to the caller and said, you know what? Let's talk about it. What's going on at home? Let's explore more. Believe it or not, she said, you know what, I'm going to talk to my parents about it. And she got the courage to be able to do that. There'll be callers as young as 9, mothers, fathers, grandparents. Recently, we had a mother that was literally miscarrying. She went to the hospital. They told her, you know what, we're sorry, you're having a miscarriage. We can't do anything. We don't have a bed for you. You need to go home. She called the helpline. She didn't think to call anybody else. It was the helpline. She'd been using the helpline. She reached out and she spoke to one of our, amazing counselors and got the support that she needed.
And when you think about that, that's really that the person was breaking the stigma. They knew they needed to ask for help, and they had used the helpline before and had a positive experience there, and that encouraged them. But the first time people are kind of scared, maybe they're hesitant, are they going to be judged? What are things we can tell the audience so they don't have to be hesitant? Can I call about, my ex, my kid who has a problem, something, I was sexually harassed at work? Is there any topic they couldn't call on? Or what would you do to say to them, call?
There's no topic that's an off topic for us. Our motto at Parents Anonymous is asking for help is a sign of strength.
And what does that mean?
It means that you don't have to be scared to ask for help. There's so much stigma around asking for help. You're considered weak. But here we like to remind everybody that you are strong by calling and saying, I need help. Can you provide the support? What can I do?
And don't you think in different cultures, there are norms around mental health, or, can you express your feelings, or told to boys, don't cry. But even in some cultures, they don't really want to talk on a cultural basis about, oh, you're really sad. Is it sadness or is it more serious depression? What is that about? Is that fear? Is that misunderstanding? What is that about?
Well, it's funny. I am a Sri Lankan American, and just the other day I was talking to my sister about the helpline. She's a parent of 3, and I encouraged her to call the helpline herself. She called. She said it was amazing.
Oh, awesome.
And it was really nice. And in my culture, it is not common to ask for help. And so I do like to encourage those, Sri Lankans, Southeast Asians, everybody to reach out. And that's what's so unique. We have a language line which covers 240 languages. So it's wonderful. We're available to everybody, literally.
And that one-on-one, even with your own sister, that building community is so important. I mean, community is represented in Parents Anonymous. I feel alone, my kid's struggling, then I go to group. I'm with a bunch of strangers. How do I make that connection? What is that about that brings people together in community for them to deal with their own underlying emotional issues and then reach out and give to others? What is that dynamic so unique?
Well, what's unique is with the Parents Anonymous groups, we cover every single topic. We're not limited. A lot of groups will focus on one subject, self-esteem building, or a different topic.
Or have an age limit, right? You can only come to this program because your kid is below 5, right?
Yes, but with the Parents Anonymous groups, you can literally address any topic that comes to mind for you, whether it's COVID, whether it's divorce, domestic violence, parenting challenges, you name it, you're gonna get the support you need, and you're gonna be able to hear other perspectives from the other parents that could have gone through very similar matters here. So they're able to provide their support, chime in, say, it's okay, we're glad you're here. Recently, we had a group where everybody's coming from different areas in California. One mother, she was in a motel. She was homeless. She was in a motel doing group. No matter what, she found a way to go to group every single week. Nobody had any idea until she shared, I'm homeless. And it was just amazing because she had recently had located housing. She said she found her housing. The whole group cheered for her and said, wow, this is so amazing. So while she was thinking, she was in the worst position, she was so down on herself, she didn't realize she had made an accomplishment because she never stopped the fight to find that housing for her and her children. And that's what the group does. It creates that community with others from various cultures, ages, different life situations, and they talk together.
And that sense of community helps to break down barriers. I'm not the only one who's got a kid with this problem. I may be the only one in that group who's homeless, and the shame that comes along with homelessness, or the shame that somebody might be on psychotropic medication, they might have been diagnosed, and maybe they're having struggles with that, and they don't want to tell anybody. Or during COVID, we know many people ended up self-medicating when they couldn't get services, and they were stressed at home with their kids, locked up 24/7, not knowing what this virus was. We know that affected the parents' mental health. It also affected the children, but the parents are the ones who want to create this loving and supportive environment. So in every Parents Anonymous group, there is a trained group facilitator, and the group elects the parent group leader, and there are all these opportunities. So it's really amazing that people can come from all walks of life, all different cultures. And we do have groups that are conducted entirely in Spanish. And the majority of our helpline counselors, correct, are bilingual. So if you do speak Spanish, you immediately get a live person who does speak Spanish so that we can address our large population of Spanish speakers in California. This is an idea we want to take nationwide. We believe that parents should be able to reach out. Prevention is the key, right? We don't want to hear, oh, my child's been struggling for 6 years and nobody's paid attention to that child in school. Or the parent says, I've been knocking at the school's door saying, how can you help me? And I've been pushed away.
Absolutely. And another thing is the counselors are trained. We put them through a very intensive training. They're master's level and even beyond. And they are there to help and provide the support. They're hungry to help and they want to support. And so they go through that rigorous training. They know how to deal with those different situations that come. And even after group, they'll check in with the parents. They will do one-on-ones to make sure that that parent is feeling supported. In addition, with the parents that come through, they will often ask for group to be longer. They will want to come back. They enjoy it. There's so much progress that happens, a whole transformative journey. We'll have parents that come in domestic violent relationships and say, you know what, I'm going to put an end to this. I'm going to leave. We have parents that have no jobs that are saying, you know what am I passionate about? They'll go back to nursing school. They'll go and do their GED. We just had one parent that passed her nursing exam and is finally a licensed nurse.
Unbelievable.
So,
and what an inspiration for other people. Because when you do one-on-one work, you're in the room with the therapist. There's nothing the matter with that. But the isolation and the challenges, and people have more than one kid. Some people just have one kid. And they go to a program and they say, oh, we can only deal with that child because they're that age group. But you're the parent to all these children. And so that in Parents Anonymous is all the family strengthening network.
Yes.
The approach that we do have groups for children and youth, and that we have a trained facilitator doing that group, and the same principles and the topics that we cover are relevant and addressed with the appropriate age group that we're talking to. And I think that that's really inspirational. And you talk about also that the people who work at Parents Anonymous are really passionate and committed. The clinical staff, the research staff, the administrative staff, everything that keeps things running. And we know that it affects us, that it makes us better at our job, but it also fills our heart. And you would not do this work if you didn't feel there was a personal benefit. Is that true?
Oh, definitely. You know, I've been in many spaces, but I will say at Parents Anonymous, this is a space where I've seen the most passionate human beings ever. You know, there's really a desire to help parents, children, and youth. And what I like is we really work with the team to correct how we speak about others and how we think about others. So many different spaces, you call people clients, you call them patients. Here we take out those labels and we look at the parents for who they are, children and youth. And because of that, I think the parents are a lot more, children and youth are a lot more motivated to get the support because we don't have a label. There is no diagnosis.
Exactly.
There is none of that. And so they're getting the support they need, and we're planting seeds here.
And those seeds are growing, even beyond them being in Parents Anonymous. We'll hear back from parents years later about how they've taken a new journey and that we're here to support their empowerment because we don't own their power either. So we're here to support people. And some people's journey is maybe a little bumpier, a little smoother. We are accepting of all of that. If people want to change and deal with their underlying emotional issues so they can create permanent change, we welcome them to Parents Anonymous. You don't have to be married. As long as you are raising a child under 18, you're welcome to be in the Parents Anonymous group, you know, whether it's your boyfriend's kids on the weekend, etc. But I want to go back to one thing in closing about talking to your sister. So when we talk to our family, it's still our family. And you still said you can get this help. Even though I'm a psychologist and I could help you, you're my sister, this is my family. And professionally, we like to put a barrier there and say, you know, I'll listen to you, I'll support you, but you might need to seek help. So that was really courageous of you to sort of establish that for her, and then for her to believe in that you're part of this organization. I'm going to try it.
Definitely. You know, there's certain things, no matter how close you are with somebody, there's sometimes certain things that they won't share about. And so I feel with her, she's always looked at therapy or getting help as a bad thing. Culturally, it's, you need help, you're crazy. But I reminded her, you know what, there's a helpline. Try it. Maybe it's a starting point. Maybe you'll want to do groups. And she really enjoyed her experience, and I could, you know, she plans on reaching out when she needs the support. So I'm excited about it.
Right, and even that word, do you think I'm crazy, really hits back on closing about our theme. Because even when you say the word mental health, people say, oh, you think I'm crazy? You think I need to be locked up? I mean, people have all these images, you know, rather than saying, you might be just stressed. You may be sad. You know, is it clinical depression? I don't know yet, you know? And so all those things, if people ask for help early, whatever they're struggling with, and see it in a normative terms, right?
Yes.
Not in these extreme terms. Crazy, not crazy. Well, you know, there are people who have serious diagnosis, and we don't label them as crazy because it's very derogatory, okay? And say, but I'll be judged that way, that we have to sort of release ourselves from those impressions people have or influences they have and change our mindset. Because asking for help, you first have to change your mindset. Are you ready to ask for help? You might not be ready. And I remember a parent sharing once, well, I talked to my whole family about the problem and they were all worn out. I needed to get somebody else to talk to, a third party who could support me, who was not related to me. Because you're so close to your family that the problem that exists there makes it, everybody wants to get involved or not get involved, and it just crosses that kind of professional barrier. And once people ask for help, the transformation for them will help them be a better parent, help them help the next friend or the next relative who's saying, oh, I don't want to reach out. I don't want anybody to know about this. Because that's what breaking the stigma is about. It's just getting rid of those labels so that asking for help is a sign of strength.
Yes.
Thank you very much, Dr. Peiris.
Thank you.